So the interesting thing is I just witnessed you serving 2 clients or patients. It looked like a mother with a child, and I found out from the father that the son was only 7.5 months old.
Yeah.
And I thought you were finished because I came to survey the place, and you went through, what did you go through? What did you actually perform?
I did the scaling of husband and wife, scaling and polishing.
But what was the first one you did? Because that's the one I was waiting for initially.
Yeah.
And it took like, how long did it take? Maybe an hour?
Yeah, maximum. The scaling and polishing of the woman along with the extraction of the
With
most
extraction?
Yes.
That's what took the longest?
Yeah, that was.
So was it extraction of what?
Extraction of the tooth. Like you can say the molar, the biggest tooth, the hard, the posterior tooth. Yeah. From where you chew. Yeah, that was not easy to just take it out. So,
wow. So that one's successful. She was
I did post-operative X-ray. I showed the extracted tooth. I showed in the mirror everything that I did this, and that's your tooth, and that's your X-ray. She was happy and she was satisfied.
No, I know. I saw that. I mean, I'm surprised. It's like she thanked you. I don't know. I've had teeth extracted before. I went to dentist. I usually don't thank my dentist when I leave. Because normally I have pains and stuff, and I just want to get out of the office. But that was interesting. And she sat there with her son. Then the husband went in. Who I had been talking to. And so what did you do with him?
Only scaling and polishing.
Okay, but he came out happy. He said his teeth was a lot cleaner now.
Yeah.
Wow.
Yeah.
So you can actually perform dentistry in a combination of ways.
Yes. Only the wife came for the treatment, and the husband said, "Okay, I'm ready. I also want." So yeah.
Oh, so
he saw me. Yeah, only it was supposed to be done by his wife only, not the guy.
Oh, so his wife is the one that with the guinea pig, and he's seen that she came out okay.
Yeah.
Oh, okay.
Yeah.
He wouldn't go first. He sent his wife in.
Yeah.
That's how I see it.
Yeah.
So tell me this, Dr. Aleena. At London Aesthetics, so who's your, I don't know, what do you call, like, who's the head?
In dentistry only, Dr. 𝗕ecie𝗂𝗿 is my boss.
Okay.
Yeah, but the boss of the whole clinic is Dr. 𝗬cie.
Okay, and what do you think about Dr. 𝗬cie? What do you know?
I have a very good interaction with her. She's very kind, she's very sweet, and she has a very soft heart. Okay. So I have few communications with her, and she's always helping.
Okay.
Yeah.
And what about Dr. Farooq?
Dr. Farooq, he is like, I feel safe when I work with Dr. Farooq, when I talk to him, and I don't feel anything, there will be any mistake or there will be something went wrong. I know he'll handle. That's the thing in my mind. I know he'll handle. So I feel safety when I am with Dr. Farooq. That's
But why do you know he'll handle it? How do you know that? How do you know he would handle it?
Because there were few things happened in the clinic and I got panicked, and it's natural instinct. The woman cannot handle everything. Women are not bulldozer. So
bulldozer. So Dr. Farooq is like a bulldozer. He could come in and clean up the mess.
Yeah. So I told him, and he was like, just relax, I'll manage. I was like, okay. Why should I worry?
Okay. Good.
So yeah.
So how has your time at London Aesthetics been?
It's really good. It's peaceful. The thing is, I really needed peace whenever I go or wherever I work. Peace is more important for me as compared to rest of the thing. So at London Aesthetics, except for the few days, I feel peace.
Okay. And so when you're dealing, how would you say, when you're dealing with patients, what is your main focus? Your main, what do you focus on? What is your motivation?
When I deal my patients, my first focus is to educate them about their hygiene. Patient, they don't know what's going on in their mouth, and when they come for the pain or anything, I try my best to explain them, tell them everything regarding what's going on in the mouth and what will happen in the future, what is the consequences of it. So they should know. I really want to educate, and I do it. I first educate the patient about their hygiene, about their problems, and then I go to the main thing for the treatment. So that's my way of doing practice of dentistry.
Okay. Well, I thank you for giving me this time. And I like your spirit. You have a very, I guess you could say, happy spirit, and that's
because
kind
I love to work. That's why my spirit is happy. I love to work.
Okay, that's beautiful. Well, thank you very much, and
no problem.
thank you for being at London Aesthetics. It sounds like a good place to go.
Yes, of course.
Okay.
Thank you very much.
Okay.
Yeah.
Allah Hafiz. So here we are, after several minutes of waiting. I finally got a chance to speak to Dr. Aleena inside London Aesthetics Clinic here in 𝗕liche 4 in Lahore, Pakistan. And for me, it was quite surprising to see such an animated, vibrant dentist, because the truth is, most of the dentists that I have witnessed and seen and even know around the world, they have usually been withdrawn, quiet, almost like engineers, introverted people who are not really friendly. So I loved her passion, I loved her spirit, and apparently so did the two patients I witnessed. They loved her as well. And I think that this is a place that can be assured to handle most treatments, whether it was Dr. Aleena or, as she said, Dr. Farooq. Thanks for watching.